Important details: the monkeypox virus, a species of the genus orthopox virus, is the cause of mpox, often known as monkeypox. The virus is divided into two separate clades: clade 1, which includes subclades 1A and 1B, and clade 2, which includes subclades 2A and 2B. The clade A and IB strain of mpox produced a global outbreak in 2022 to 2023. Even now, clades IA and IB are still a threat to public health, as seen by the recent spike in cases in the Democratic Republic of the Congo and other nations. There are mpox vaccinations available. In addition to other public health measures, vaccination should be taken into consideration. The most common signs of mpox are mucosal lesions or a skin rash that can last 2 to 4 weeks, along with fever, headache. Mumps can be spread by intimate contact with an infected person, contaminated objects, or sick animals. The virus can infect the fetus during pregnancy and can also infect the infant during or after delivery. Supportive care for mpox symptoms, such as pain and fever, is provided. Diet, hydration, skin care, avoidance of secondary infections, and treatment of co-infections, including HIV when present, are also closely monitored. Summary: a painful rash, enlarged lymph nodes, fever, headache, muscular ache, back pain, and low energy are all possible symptoms of the viral disease mpox. Most patients get better completely, while some get very ill. The monkeypox virus is the cause of mpox, MPXV. It belongs to the Poxviridae family of viruses, which also contains vaccinia, cowpox, variola, and other viruses. It is an enveloped, double-stranded DNA virus belonging to the orthopox virus genus. The virus is divided into two separate clades: clade 1, which includes subclades 1A and 1B, and clade 2, which includes subclades 2A and 2B. A global outbreak of clade 2B began in 2022 and continues to this day, including in some African countries. There are also growing outbreaks of clades IA and IB, affecting the Democratic Republic of the Congo and other countries in Africa. As of August 2024, clade IB has also been detected beyond Africa. The natural reservoir of the virus is unknown, but various small mammals, such as squirrels and monkeys, are susceptible. Transmission mpox spreads from person to person, mainly through close contact with someone who has mpox, including members of a household. Close contact includes skin-to-skin, such as touching or sex, and mouth-to-mouth or mouth-to-skin contact, such as kissing. And it can also include being face-to-face with someone who has mpox, such as talking or breathing close to one another, which can generate infectious respiratory particles. Individuals who have had several sexual partners are more likely to develop mpox. Additionally, mpox can spread through infected items like linens or clothing, needle injuries received in medical settings, or public places like tattoo parlors. Pregnancy and childbirth can transmit the virus to the fetus. Experiencing mpox during pregnancy might pose a threat to the developing fetus or infant, perhaps resulting in pregnancy loss, stillbirth, infant death, or problems for the carrying parent. The mpox virus can spread from infected animals to people through bites or scratches, as well as through tasks like cooking, skinning, trapping, playing with carcasses, and consuming animals. More research is being done to determine the monkeypox virus's animal reservoir. The ways that mpox spreads during outbreaks in various contexts and circumstances require further investigation. Symptoms and indicators. Signs and symptoms of mpox often appear 1 week after exposure, although they can also appear 1 to 21 days later. Usually lasting 2 to 4 weeks, symptoms can linger longer in people with compromised immune systems. Typical mpox symptoms include rash, fever, enlarged lymph nodes, sore throat, headache, muscle aches, back discomfort, and low vitality. Some people get a rash as soon as they get the mpox, while others may experience fever, aches in their muscles, or sore throats first. Often starting on the face, The mpox rash travels throughout the body, ending on the palms of the hands and soles of the feet. It may also begin on other bodily areas, such the genitalia, where contact was made. It begins as a flat sore that turns into a blister that is uncomfortable or itchy and filled with liquid. The lesions dry up, crust over, and eventually fall off as the rash cures. While some people may only have a few skin lesions, others may have hundreds or even thousands. These can show up on the body in any location, such as face, mouth, and throat, groin and genital areas, palms of hands and soles of feet. Anus, proctitis, a painful enlargement of the rectum, dysuria, or pain and difficulty swallowing are some conditions that some people experience. Until all wounds have healed and a new layer of skin has grown, those who have mpox can infect others. A person can be infected and not show any signs in other people. While cases of mpox acquired from asymptomatic, symptom-free individuals have been documented, data on prevalence remains scarce. Complicacies from mpox put pregnant women, children, and those with weakened immune systems, including those with uncontrolled HIV, at increased risk of serious disease and death. Some mpox sufferers have severe illness. For instance, bacterial infections of the skin can result in abscesses or severe skin damage. Additional complications can include sepsis, pneumonia, encephalitis, myocarditis, proctitis, rectum, genital organ infections, urethritis, pain or difficulty swallowing, vomiting and diarrhea, leading to dehydration or malnourishment, and infections of the blood, brain, heart, or urinary tract. Some cases of mpox can be fatal. Medical care and immunization, taking care of the rash, controlling the pain, and avoiding complications are the main objectives of mpox treatment. To assist control symptoms and prevent worsening of the condition, early and supportive care is crucial. Pre-exposure prophylaxis, or getting the mpox vaccination, can aid in infection prevention. For those who are highly susceptible to mpox, particularly during an outbreak, it is advised. Prevention and self-care. The majority of mpox patients recover after 2 to 4 weeks. Actions to alleviate symptoms and stop mpox from spreading to others. Do for guidance. Speak with your healthcare provider. Keep yourself at home, preferably in a room with good ventilation. Wash your hands frequently, preferably with soap and water or hand sanitizer, especially before or after contacting sores. Until your rash cures, cover your lesions with a mask when you're among other people. Maintain dry, exposed skin, unless sharing a room. Prevent handling objects in communal areas and regularly clean shared places. Use mouth sore rinses with salt water. For body sores, try warm baths with Epsom salts or baking soda. And use over-the-counter pain relievers such as paracetamol. Do not shave sore areas until scabs have healed and new skin appears underneath. This can transmit the rash to other parts of the body. Pop blisters or scratch wounds, as these actions can hinder healing, spread the rash to other regions of the body, and cause sores to become infected. Those who have mpox should stay home and follow their doctor's instructions to avoid spreading the illness to others. If necessary, they can stay in the hospital throughout the contagious period, which lasts from the time symptoms start to appear until the lesions have healed and the scabs come off. When among other people, covering sores and donning a mask that fits properly may help stop the spread of the infection. Condom use during intercourse can help lower the chance of contracting. The chance of contracting mpox can be decreased by refraining from having intercourse with new partners during times when transmission is most active. After coming into contact with someone who has the mpox, a person should watch out for symptoms for 21 days, 3 weeks, and take preventative measures, like not having intercourse during that time. When caring for patients with mpox, health professionals should take precautions against infection and control. These precautions include wearing the proper personal protective equipment, PPE, such as gloves, gowns, eye protection, and respirators, following protocols for safely swabbing lesions for diagnostic testing and using sharp objects like needles. Breakouts. In 1958, the monkeypox virus was found in Denmark in monkeys housed for scientific purposes. A 9-month-old child in the Democratic Republic of the Congo was the first person to contract mpox, 1970. After smallpox was eradicated in 1980 and smallpox vaccinations were stopped globally, mpox gradually spread throughout Central, East, and West Africa. Since then, isolated cases of mpox have been documented in West Africa, Clade 2, and Central and East Africa, Clade 1. The United States of America experienced an outbreak in 2003 that was connected to imported wild animals, Clade 2. Every year since 2005, the Democratic Republic of the Congo has received reports of thousands of cases. In Nigeria, mpox resurfaced in 2017 and is still spreading among individuals there. An mpox outbreak that arose unexpectedly in May 2022 quickly expanded to all 6 WHO regions, then to Europe and the Americas. The worldwide pandemic has predominantly, but not only, impacted gay, bisexual, and other men who are in relationships with other men. It is transmitted from person to person via sexual networks. Here is more information about the worldwide outbreak, including details on local reactions to contain it. Clade Y outbreaks of mpox happened in Republic of the Sudan refugee camps in 2022. In the Democratic Republic of the Congo, there has also been a rise in mpox cases and fatalities since 2022. Clade IB is a recent branch of Clade I that has been spreading person to person in various parts of the nation. As between January 2022 and August 2024, more than 120 nations reported cases of mpox. Of those, over 100,000 had laboratory confirmation, and over 220 resulted in deaths. Discrimination and stigma. Discrimination and stigma around any illness are never acceptable. The stigma associated with mpox can impede public health initiatives or extend an outbreak of the disease by making patients less likely to seek care and treatment. In the case of mpox, stigma, prejudice, and racism have been targeted mostly at the groups initially most impacted by the illness: transgender communities, men who have sex with men, and communities that are gender diverse. WHO reaction. WHO collaborates with partners and member states to stop and contain mpox epidemics. This entails organizing studies on vaccinations and therapies, bolstering national health systems, and striving to provide fair access to medications, treatments, diagnostics, and other instruments. Mumps has been deemed a public health emergency of international concern, PHEIC, twice by WHO Director General Dr. Tedros Adhanom Ghebreyesus, once in May 2022 and again in August 2024. Highly recommend that you watch the following video, which covers some tips. Thank you so much for watching. Don't forget to subscribe, and see you next time. And take our analysis quiz to find the best program for you.